In most cases, the best way to replace missing teeth is with dental implants. Dental implants are small titanium fixtures which are inserted into the jawbone during a routine surgical procedure. The jawbone then heals around the implant and integrates it, a process called osseointegration, making the implant a very strong anchor to hold teeth. If you're missing a single tooth, there are two options to replace the tooth with a fixed restoration. One option is a 3-unit bridge, which has been used in dentistry before dental implants became available. While a 3-unit bridge can still be the option of choice for some situations, it is associated with several disadvantages over dental implants. A 3-unit bridge requires grinding down both adjacent teeth, called abutment teeth, to stumps, hence causing irreversible loss of healthy tooth structure. A 1-tooth problem becomes a 3-tooth problem, since the adjacent teeth will now also require treatment. If the bridge fails in the future, it often means that 3 teeth need to be repaired or replaced. Food tends to get caught more often under a bridge, and cleaning is more challenging since one has to floss underneath the pontic. This chronic food impaction often leads to dental decay or periodontal disease and bone loss at the abutment teeth over time, which, when not detected early, can lead to the loss of one or both abutment teeth. The 2 abutment teeth have to bear the load of 3 teeth now, which puts the abutment teeth at a higher risk to break. If one of the abutment teeth had a root canal in the past, this risk is increased substantially since root canal treated teeth are weakened and brittle. Aesthetically, it is often more difficult to make teeth look natural when the individual teeth are splinted together instead of being separated. When replacing a missing tooth with a dental implant instead of a bridge, many of those inherent disadvantages do not apply. Healthy tooth structure at adjacent teeth does not have to be sacrificed. A 1-tooth problem remains a 1-tooth problem. One can floss easily. A dental implant cannot experience dental decay since it is made out of titanium. Adjacent teeth do not have to bear additional load, and the result in most cases will be aesthetically more pleasing. If you're missing several or all your teeth, dental implants are often the only option to provide you with a fixed restoration, teeth that cannot be removed. Not only do traditional removable prostheses frequently come loose or look aesthetically unpleasing, they also collect food underneath, often cover the roof of the mouth, hence affecting speech and restricting one's ability to taste food, and tend to cause significant trauma to abutment teeth, gum tissue, and the underlying jawbone. Partnerships can be strained when prostheses have to be taken out at night. Therefore, dental implants have revolutionized dental care and have fundamentally improved the quality of life for those patients. The placement of dental implants is a routine surgical procedure for experienced and well-trained clinicians. It entails 2 parts, a surgical and a restorative part. The surgical part, placing the fixture, will be done in my office, while the restorative part, placing the actual tooth on top of the fixture, will be done by your primary care dentist. Therefore, please note that the treatment estimate you will receive today only includes my part of the treatment, but not the restorative part, which will be done by your primary care dentist. After local anesthesia, also known as Novocaine, is administered, the gum tissue is reflected to give access to the jawbone. The dental implant, a small titanium screw, is then inserted into the jawbone. If there is not enough bone to allow for placement of the implant, a bone graft may be needed to regenerate the missing bone. The bone graft I will use is either a bovine xenograft, meaning bone from the cow, or a human allograft, meaning human donor tissue. Both bone grafts are safe to use and have been tested extensively over many years. A porcine collagen membrane using collagen from the pig is then placed to cover and protect the bone graft. Sometimes growth factors are used to improve healing and boost bone regeneration. After the implant, and if needed the bone graft, have been inserted, the gum tissue is sutured around or over the implant, and a healing period of 2 to 3 months is allowed for the implant to integrate. A small uncovering procedure may be necessary if the implant needed to heal underneath the gum tissue. If the gum tissue around the implant is too thin, a gum graft may be needed before or after implant placement. After the implant has healed successfully, your primary care dentist will continue with restoring the implant and putting the actual tooth on it. Treatment sequence and approach for front tooth implants, replacing incisors or canines, differs from back tooth implants, replacing molars or premolars. After the failing back tooth is removed, the jawbone needs to heal for 3 months before it can receive the implant. After the implant is placed, it needs to integrate for another 2 to 3 months before it can be restored. Therefore, for a standard back tooth implant, it will take 5 to 6 months from the time of extraction until I can send you back to your primary care dentist to restore the implant. If you do not have enough bone for a dental implant and a separate bone grafting procedure is needed, an additional up to 9 months of healing may have to be allowed. Whether such a procedure is necessary is generally evaluated on a dental cone beam CT, which is usually taken 3 months after the extraction. Sometimes a separate gum graft is needed, which would take an additional 3 months of healing. Treatment for front tooth implants differs from back tooth implants since the jawbone in the front section of your jaw is much thinner, and since it is more important that the result is aesthetically pleasing because this area tends to be visible when you smile. In my practice, front tooth implants are placed computer-guided since this technology cuts down treatment time, increases precision, and enhances predictability. Data from a dental cone beam CT is merged with data from an optical intraoral scan of your teeth, and the exact position of the implant can be planned precisely on the computer based on your individual anatomy. A surgical guide is then 3D printed and will help me place the implant exactly in the correct position. With the help of such technology, and since front teeth are smaller than back teeth, front tooth implants can sometimes be placed at the time of extraction. In those cases, only one surgical procedure and only 3 months of healing are needed before the implant can be restored. If the implant cannot be placed at the time of extraction, the implant is inserted in a separate procedure 2 to 3 months after extraction. As is the case for back tooth implants, additional healing time for separate bone grafting or gum grafting procedures may be necessary. During the healing time, you will be given an Essex appliance as a temporary replacement of the missing teeth. This appliance looks like a clear aligner or Invisalign retainer and snaps on your other teeth. Please only wear the Essex appliance when you need to for aesthetic purposes, so the implant area can heal undisturbed. Dental implant treatment has become one of the most predictable procedures in dentistry when performed by a well-trained and experienced clinician. Possible complications include excessive bleeding, infection, nerve injury, and implant failure. With proper planning and execution, and when postoperative instructions are followed, these complications are rare. Should an implant fail to integrate, which may occur after an infection, the procedure may have to be repeated. Permanent numbness as a consequence of nerve injury is possible but extremely rare. Bruising and swelling are common and usually last for a week. You will have to eat soft food for at least 6 weeks after the procedure and will be asked to minimize physical exercise for the first 2 weeks. Postoperative antibiotics will be given to prevent an infection. The procedure itself will not hurt since you will be numb. There will be mild to moderate discomfort for a few days after the procedure, which usually can be managed with over-the-counter pain medication. So, congratulations for taking the first step to dental implant treatment and a better quality of life by visiting our office today. We're looking forward to treating you.